hands down correct. Mom is most assuredly the chief medical officer of most families. Not universal. It's not always the case. Many times dad shows up. But hands down, mom is the one who's managing the healthcare and the healthcare decisions that are made in families. Now, why is that? Frankly speaking, women tend to educate themselves better regarding healthcare. When they themselves have a problem, they're more likely to go online and do research about the issue at hand. They're going to be doing research about the symptoms, the signs, the treatment options, and the providers, and the outcomes. Men tend to avoid healthcare. Women tend to seek it. And so their experience with the entire healthcare system is just greater. And it shows through in this medical decision-making practice for families. Family coordination and logistics is another big issue. Mom is more likely to be in charge of transportation. She is far more likely to make an appointment. I mean, when was the last time you heard dad say, okay, kids, let's go to the doctor? It's just not as common. Paperwork. That sounds really simple, doesn't it? It's not. It's complicated. Mom's far more likely to have all the information in one place to fill out paperwork appropriately. Then there's this issue of trust and communication with providers. We as providers play into that. When I direct information to a family, I tend to direct it more to mom on the basis of all the things that we just talked about. I don't ignore dad. First of all, though, mom is usually the one there. A smaller percentage of the times dad is present, and when he is, I certainly direct my attention toward him. But by and large, providers tend to direct their attention toward mom. Then there's this issue of emotional connection. Mom tends to know the nuances of children's behavior. And when that changes, they're more apt to notice it sooner. So the small, subtle signs and symptoms, mom is more likely to pick up on. Mom was more likely to ask questions about. Mom is far more likely to keep track of. And so this starts the process of going down the healthcare request pathway. She's going to start looking at the signs and symptoms. She's going to start watching for changes. She's going to start gathering information regarding these things. And again, looking into treatment options, looking into providers, looking into outcomes. So women just are, frankly speaking, more educated about the healthcare system. They're more apt to make appointments. They're more apt to do transportation. They're more apt to fill out paperwork. They're just more apt to pay attention. So hands down, without question, and again, it's not even close, mom is the chief medical officer of the family.